What probiotics are best for preventing UTIs? Imagine a tiny army of friendly bacteria working quietly inside your body to keep you healthy. When it comes to preventing urinary tract infections, certain probiotics have shown promising results. The most studied and beneficial strains are from the Lactobacillus family, especially when taken either orally or directly into the vagina. These bacteria help maintain a healthy balance in the vaginal and urinary tract areas, which is key to preventing harmful bacteria from settling in and causing infections. Lactobacillus rhamnosus, Lactobacillus crispatus, Lactobacillus acidophilus, and Lactobacillus casei are among the top strains researchers have looked at. They work by sticking to the lining of the urinary tract, creating a protective barrier that stops bad bacteria from attaching and multiplying. This is important because many urinary tract infections are caused when bacteria like Escherichia coli latch onto the bladder and cause inflammation and discomfort. Some studies suggest that taking probiotics containing these lactobacillus strains can reduce the chances of getting recurrent UTIs, especially in women who experience them often. Using probiotics directly in the vagina might be more effective in some cases because it targets the area most involved in urinary infections. However, taking them by mouth can also support overall urinary tract health, as these bacteria can travel and colonize the gut and vaginal areas. It's important to note that the scientific evidence isn't entirely consistent. Some research shows clear benefits, while other studies find little difference compared to placebo or antibiotics. Variations in probiotic strains, doses, how they are delivered, and individual health differences all play a role in these mixed results. More large-scale, well-designed studies are needed to confirm exactly how best to use probiotics for UTI prevention. From a broader health perspective, keeping the urinary tract microbiome healthy with probiotics might help reduce inflammation caused by infections. Since inflammation can irritate the bladder and potentially contribute to other bladder issues, supporting a balanced microbiome could be beneficial. But it's essential to remember that probiotics are not a replacement for standard medical treatments. They should be considered as a complementary approach, used alongside good hygiene, proper hydration, and medical advice. If you're thinking about trying probiotics for UTI prevention, talk with your healthcare provider first. They can help determine if this approach is right for you and recommend specific strains and dosages. Remember, every person is different, and what works for one might not work for another. Maintaining good habits like drinking plenty of water, wiping from front to back, and avoiding irritants like harsh soaps can also help keep your urinary tract healthy. For those with bladder cancer or at risk, preventing infections is especially important to avoid additional irritation or complications. Always follow your doctor's guidance and use probiotics as part of a comprehensive plan for bladder health.